This week, we're going to talk about the timing of sex. Premature ejaculation, the vast majority of people actually suffer from this with ejaculation time of less than 1 minute. So that begs the question, what is normal? So Timing Tim wrote to me and asked me about his problem. He thinks he's got premature ejaculation. In fact, premature ejaculation is a condition diagnosed by International Society of Sexual Medicine. It needs to contain 3 components. First of all, it's the timing. Secondly, it's a lack of control. And thirdly, it needs to bother somebody or bother their partner in their sexual experience. In fact, there are many studies that has been done to identify what is normal. The normal duration of sexual intercourse is between 5 and 8 minutes, and there are multiple studies that demonstrated that. So it's not what you've been thinking, that it's about 25 minutes. So for men who genuinely suffer from premature ejaculations, obviously are concerned. Apart from their history, actually in research setting, we do something called IELT, intravaginal latency period. It's actually as primitive as the partner pressing on a stopwatch upon penetration and also the stopwatch upon completion. And that's the way we measure this in a scientific setting, trying to see whether medications will work or not. Obviously, this is not the diagnosis or the mean to diagnose you in the clinic. Therefore, from the history alone, we are able to identify whether men suffers from premature ejaculation. The good news is there are lots of medications that can help. Obviously, there are cognitive treatments, there are medications that can be actually applied on the penis itself, and also medications that can be consumed in order to prolong the interval of intercourse. So therefore, for those of you like Timing Tim's who's suffering a little bit of premature ejaculation and feel they are a little bit shortchanged when it comes to timing, why don't you go and see doctors and perhaps get that fixed? You must be wondering, what are we going to talk about next week? I'm a urologist, I look after the men, and we're going to talk about menopause in men. I can hear a lot of you shouting, saying there's no such thing, there's no menopause, that's why it's called menopause. But when the testosterone depreciate or actually diminish with age, and what is the impact on sexual function? What's the impact on drive? And what's the impact on libido? That's what we're going to discuss. And what is the clinical implication and how are we going to intervene if it really affects somebody?